Welcome to Nursing Online Education. Today we are discussing about some nursing related questions and answers. Which of the following should the nurse implement to prepare a client for a KUB kidney, infector, bladder radiography test? Option A. Clients must be NBO before the examination. B. Enema to be administered prior to the examination. C. Medicate client with Laxic 20 mg for 30 minutes prior to the examination. No special orders are necessary for this examination. And the answer is no special orders are necessary for this examination. Next question. A triage nurse has these 4 clients arrive in the emergency department within 15 minutes. Which client should the triage nurse send back to scene first? Option A. A 2-month-old infant with a history of rolling off the bed and has bulging with crying. B. A teenager who got a saint beard while camping. C. An elderly client with complaints of frequent liquid brown-colored stools. D. A middle-aged client with intermittent pain behind the right scapula. And the answer is a teenager who got a saint beard while camping. Here, note the point. The client is in the greatest danger with a potential of respiratory distress, and any client with a saint facial hair has been exposed to heat or fire in close range that could have caused serious damage to the inferior lungs. And note that the inferior linings of the lungs have no nerve, so the client will not be aware of swelling. Next question. The nurse is caring for a client with a serum potassium level of 3.5 MEq per liter. The client placed on a cardiac monitor and receives 14 MEq potassium chloride in 1000 ml of 5% dextrose in water or. Which of the following ECG patterns indicates to the nurse that the infusion should be discontinued? Option A. Narrowed QRS complex. Option B. Shortened PR interval. Option C. Tall peaked T waves. Option D. Prominent U wave. And the answer is tall peaked T wave. Here, note the point. A tall peaked T wave is a sign of hyperkalemia. The doctor should be noticed regarding discontinuing the medication. Next question. A nurse prepares to care for a 4-year-old newly admitted Rhabdomyosarcoma. The nurse should alert the staff to pay more attention to the function of which area of the body? Option A. All striated muscles. Option B. The cerebellum. Option C. The kidneys. Option D. The leg bones. And the answer is all striated muscles. Here, note the points. Rhabdomyosarcoma is the most common children's soft tissue sarcoma. It originates in striated or skeletal muscles and can be found anywhere in the body. And the clue is in the middle of the word myo, which typically means muscles. Next question. The nurse anticipates that for a family who practice Chinese medicine, the priority goal would be to option A. Achieve harmony. B. Maintain a balance of energy. C. Respect life. D. Restore yin and yang. And the answer is restore yin and yang. Here, note the point. For followers of Chinese medicine, health is maintained balance between the forces sexes of yin and yang. Next question. A client has a Swan gang catheter in place. The nurse understands that this is intended to measure option A. Right atrium function, option B. Left heart function, option C. Renal tubule function, option D. Carotid artery function. And the answer is left heart function. Here, note the points. The Sangham's catheter is placed in the pulmonary artery to obtain information about the left side of the heart, and the pressure readings are inferred from pressure measurements obtained on the right side of the circulation. And right-sided heart function is assessed through the evaluation of the central venous pressure, or CVPS. Next question. A nurse enters a client's room to discover that the client has no pulse or respirations. After calling for help, the first action the nurse should take is option A. Start a peripheral flow, option B. Initiate closed chest massage, option C. Establish an airway, option D. Obtain the crash cart. And the answer is initiate closed chest massage. Here note the point. As per revised AHA guidelines of cardiopulmonary resuscitation, the chest compression is always the primary objective in a cardiopulmonary arrest. Next question. Total number of bones in human body. Option A 210, option B 206, option C 216, option D 260. And the answer is 206 or 206. Next question. Total number of muscles in human body. Option A 639, option B 459, option C 559, option D 630. And the answer is 639. Next question. Flag signs is a characteristic feature of which disease? Option A poliomyelitis, option B marasmus, option C rickets, option D kwashiorkor. And the answer is kwashiorkor. Here note the point. A change in hair color in which the hair becomes discolored in a band perpendicular to its long axis. This is seen in kwashiorkor and indicates a period of severe malnutrition. Next question. During tonic-colonic seizure, priority nursing intervention is option A. Prevent injury, B. Maintain patent airway, C. Restrain the patient, D. Administer oxygen. And the answer is maintain patent airway. Next question. Which among the following position is used to assess the inguinal hernia? A. Sit down and bear down position, B. Weight lift position, C. Lithotomy position, D. Standing position. And the answer is sit down and bear down position. Next question. Typical type of play in a toddler is option A. Solitary, option B. Parallel play, option C. Cooperative, option D. Associative. And the answer is parallel play. Sequence of taking vital sign in a newborn infant is option A. Temperature, pulse, respiration, B. Pulse, respiration, temperature, C. Respiration, pulse, temperature, D. Respiration, temperature, pulse. And the answer is respiration pulse temperature. A false unshakable belief is option A illusion, B hallucination, C delusion, option D attention. And the answer is delusion. Thank you.